Board out. It's my pleasure to be here and introduce our speakers tonight. So our first speaker, we always like to start off the evening with a talk from a patient or a caregiver. I think it's very good for everybody to hear that you're not alone and that somebody else is sort of walking side by side with, even if it's on a slightly different journey. So tonight it's my pleasure to introduce Mike, and way up there. So I'm going to introduce Mike to come down and talk to you. He's recently started out on his journey with kidney cancer, and he's got a very interesting and unique story to tell all of us tonight. Thank you, Mike.
Thank you. Good evening, everyone. I was asked to share my experience with high-dose interleukin-2 by Deb Maskins. It's going to be a bit of a rant. In order for me to do that, I must share with you that what I have learned about our healthcare legal system and my journey through it. I call it a healthcare legal system as I had to fight for justice. As a Canadian, I equate our healthcare system to be just as important as the Canadian Charter of Rights. After all, isn't our healthcare system supposed to be the envy of the world? The Charter of Rights and Freedoms guarantees civil rights to everyone in Canada, from the policies and actions of all areas and levels of government. It is designed to unify Canadians around a set of principles that embody those rights. Section 15 of the Charter guarantees equal treatment before and under the law and equal protection and the benefit of the law without discrimination. Shouldn't those same principles apply to our healthcare system? Prior to being told I had kidney cancer, I thought that all Canadians had equal and without discrimination access to all treatments and drugs that were approved by Health Canada. I thought it was Health Canada, not Health Ontario, not Health BC. The preamble of the Canadian Health Act states the objective of Canadian healthcare policy is continued access to quality health care will be critical to maintaining and improving without financial or other barriers the health and well-being of all Canadians. I was wrong in believing that we had an equal and fair healthcare system. I quickly learned that it did not matter if the treatment or drug that could save or prolong your life was approved in Canada. What really mattered was where you lived in Canada. I come from a law enforcement background where I learned over the years that sometimes it didn't matter if the evidence proved that you were guilty or innocent, but more importantly, how the legal system applied. I believe we have drifted away from the principles and ideology that our forefathers intended for all Canadians in our Canadian healthcare legal system. Again, I call it a healthcare legal system. It seems to me that bureaucrats can decide our fate, tell us which drugs to take and in what order. They can decide which drugs you can take, not what your doctor recommends. The government may even refer to experts for their rationale. I submit to you that I can find an expert to support any point of view, especially when the problem does not have a clear and decisive answer. After doing my research and speaking with numerous people, including our very own Deb Maskins, I decided after consulting with my doctor that I wanted to give IL-2 a shot. After all, it was approved in Canada, and it was one of the only treatments that could provide a durable response and possibly live the rest of my life without cancer drugs. I know the complete and partial response may vary depending on who you want to believe, but I didn't see anything else out there that guaranteed me anything better. As it turned out, living in Ontario, I was one of the first to be affected by the government cuts, where we used to send patients to Buffalo or Montreal for IL-2 treatment. If I lived in Quebec or Alberta, there wouldn't be any problems in getting the IL-2 treatment as it is provided for in those provinces. I was diagnosed in January of 2012. The cuts became effective in October 2011, and the battle began. My doctor agreed with me that I was a good candidate for IL-2. I was fit, met the strict prerequisites for IL-2, and I knew it wasn't going to be easy, but neither is kidney cancer. I applied to our provincial government for out-of-country treatment in Buffalo as it was close to home and was denied. We used to send patients there before the cuts. I then applied to go to Montreal for treatment and was again denied. This all took months as my cancer grew. It was time to pull out all the stops. I wasn't giving up. I contacted everybody I knew, including my MPP, who brought up my case in Parliament, and wrote letters to the Ministry of Health. People I knew and didn't know wrote letters of support. I wasn't getting anywhere, and time was not on my side. I then did something that I did not want to do. I went to the media and told my story. I'm a private person when it comes to my health care and my family, but I had no choice. Several articles appeared in the Hamilton Spectator that got the attention of the ministry. At the end of the day, our province agreed to pay for my hospital stay in Montreal, and the IL-2 drug was donated to me on compassionate grounds by Novartis. I don't know exactly what changed the government's mind. It was probably a combination of initiatives. For that, I am grateful to everyone that helped me. I started my treatment on the 3rd of December in Montreal. I had a center line put into my chest so that they could administer the drug directly into my heart. I was determined to do the full regimen, which was 12 doses, 1 dose every 8 hours for a week. I remained in hospital for that entire week. People have asked me, what was it like? I tell them it was tough but doable. Some of the side effects were little sleep, weight loss, no appetite, racing heart, low blood pressure, chills, flu-like symptoms, some diarrhea, water retention, and itchy and peeling skin, and rigors. Rigors are uncontrollable shaking that after receiving the IL-2, that happened to me approximately 60 to 70% of the time. When I felt it coming on, the nurses would give me Demerol, which would stop the shaking. I was in hospital for the week, went home for a week, and then did it all over again for another week. I have nothing but kind words to say to everyone that helped me. I don't know if the IL-2 worked for me or not, as I'm scheduled to have a CT scan soon, but no matter what those results are, I have no regrets and would do this again in a heartbeat. My fear is that I will be the last person from Ontario to be given access to IL-2. This is just wrong, as it's denying any cancer patient any drug that has been approved by Health Canada just because we live in Ontario. If you take one thing away from this, you must be your own advocate. It's your life. Gather as much information about your particular disease as you can by doing your own research or get someone to help you. Explore websites like Kidney Cancer Canada, as they are a great source of information and a great bunch of folks to talk to. The treatment you finally decide on should be between you and your doctor. Until there's a cure for kidney cancer, the best experts can do is offer you their best guess on what might work for you. If that is the case, we as patients must have a say as to our treatment, and all kidney cancer treatments must be available to all Canadians, no matter where you live. Thank you very much.